One of the things that's really interesting and why I enjoy mentoring students and junior faculty, I love to be able to explain to them that my path was really not a straight path. And that's probably much more common than they think.
I think we both at some point in our lives were told, you can't do this. You can't become a doctor. But I think, like Benny, Dr. Maldonado said, well, I'll just show you. I remember first meeting Bonnie as a clinical student. She was, at that time, a very vocal leader of the Latino medical students.
It was really exciting to be able to advocate for medical students around the country and look at the broader issues around medical care and what we were doing for patients and how to be the best doctor possible. I was lucky and I was fortunate that there was a position available in the residency program at Johns Hopkins. That's where I really started to develop my research interest in infectious diseases. I was working on rotavirus, which is a virus that causes diarrheal disease, and at that time would kill more than 1 million children a year. That's what led me to go to CDC, because I realized that I needed to hone my epidemiologic skills. I loved science, I loved medicine, but I also loved the concept of public health and prevention. What you could do with a young life before the infant was even born, and beyond that, in the first formative years, to prevent diseases.
Bonnie combined her infectious disease specialty research with very active involvement in public health and understanding how to deliver vaccines most effectively and how to make sure that children in various communities get the benefits of vaccine.
What happened during my time at Johns Hopkins and then CDC, and more importantly when I came here, was the HIV epidemic. I started the HIV clinic here, and I built an epidemiologic study in collaboration with the State Health Department and CDC to understand the natural history of HIV in children so that we could develop treatments and cures, potentially cures.
Bonnie has done a wonderful job as chief of our pediatric infectious disease division. She's expanded our physician team. She's expanded our education program. She's supported many new faculty. She's been a tremendous mentor for every one of them.
We want, as much as possible, for our physicians here at Stanford to look like the face of the United States and the face of our patients, and really trying to give opportunities to people who may face disparities in their ability to get the education that they need to be able to succeed.
That theme of let me show you what I can do is something that people like Dr. Maldonado, who have not only just succeeded, but succeeded to the highest extremes, just reminds us how we can't make those judgments about who can be a physician or a leader in science.
Dr. Maldonado is entirely responsible for my entire professional career. She is so warm and so open and so accessible that I think that's part of what makes her special as a doctor, as a teacher, as an educator, as a mentor, because she's just genuine. And she makes you feel like, there's no dumb idea and that you can ask and you can ask for help. And if that's not a magical talent, I don't know what is.